So we have a patient who's interested in addressing submental fullness. She has previously been treated with Kybella in the past and is interested in a second treatment because she felt like she got such a good response from the first treatment. The way I gauge that is if she makes her muscles tense in her neck. Can you do that for me? If you can pinch fat or softness over top of those muscles, that is treatable with the medication. Great, so I still feel like there's enough to go after there in a second treatment, and she knows that sometimes this treatment requires a few repeated procedures in order to get your maximal result. So the first thing we'll do is we'll start by marking her. We typically mark along the jawline. And then we mark a little bit below that so that we're not going into the area where a nerve that moves the smiling part of your face will be affecting things. I mark the lower border of the treatment area. And then we'll place a grid tattoo on there that will allow us to know exactly where we want to make the injections, and then we'll do the injections, okay? How did it feel for you when we did it the first time?
It felt really, well, originally I was afraid of it and didn't know how big the needle was, but it really didn't, it was very minimal pain, very minimal discomfort during the procedure. You know, a little bit stinging afterwards and a little bit of swelling, but it was very, very minimal discomfort.
And I would say that's pretty typical of patients who are undergoing the procedure for the first time, that often there's some, apprehension about what it's going to be like, but once they get the first couple of injections in there, they end up feeling like it's pretty tolerable and manageable. Now, you knew that we always had the option of putting some numbing medication in there, but that involves some injection as well, so you'd have to put up with either that needle or the needle for the injection. So it's kind of a toss-up as to which one you choose to do.
Yeah, I don't think...
What would you like to do this time around? Do you want to do it the same way?
No, I don't need to do
the numbing?
Yeah, I don't need it. The pain it's bearable.
Okay, great.
It's not bad at all.
Wonderful. All right, rest your head back here, and we'll put on the marking grid. And thank you very much. Great. Okay, so we'll clean you off with some alcohol here. And then typically, I'll ask you to grimace again. Exactly. Good, and then relax. And you're gonna feel me now. That's the first little injection. We'll do one right next to it. This is just gonna have a great result. I'm so excited to see your results. Be right here and right there. Good, you did it.
Yay.
No, well done.
This is my second round of the Kybella procedure on my neck. I just got finished with it, so you may see some redness. My first experience with getting Kybella was about 9 weeks ago, and my experience was overall really, really well. Very minimal pain and discomfort during the procedure. After the procedure, I did feel a little bit of stinging, a little bit of swelling for the first couple of days, and a little bit of bruising. But overall, I saw, I was literally able to see kind of the fat melt away from under my chin, which was really amazing. After the procedure, I was able to go back to my regular, daily life routine, going to the gym, going to work, with very minimal visibility on the swelling, able to go out with friends after a few days. And overall, I didn't have to wear any bandages or anything that was able to show that I had something done, which was great. So overall, I had a really great experience. Dr. Horn's very light with her hands, so I wasn't able to feel, being too much discomfort, being, you having the needle used on me. And I'm very, very happy with my result.